Oh, so I'll just start again in case I missed anyone there. So hi and welcome to this UCU webinar on LGBT plus mental health. I'm B. Hughes, my pronouns are they, them, theirs, and I'm going to be chairing the session today as the newly elected rep for LGBT plus members in higher education, a role that I'll start after Congress. So we have some really great speakers who are going to address the webinar today. The focus of this event is on LGBT plus mental health during COVID, similarities and differences to the height of the HIV and AIDS epidemic, and why LGBT plus mental health is a union issue. So to open the webinar, it's my pleasure to introduce President of UCU, Vicky Blake.
Thank you, Bea, and thank you very much for inviting me to say a few words just to open up this webinar. What I really want to begin with saying is how centrally important the issues that we're talking about today are to the agenda of the union as a whole. It is well known that the LGBT plus community is underserved by mental health provision, that there is a crisis in mental health provision specifically, but generally, but also through this past year of pandemic, there have been very particular impacts on people who are in the LGBT plus community that have not really been recognised or addressed by the government. And we see it as very much our job as a union to be pushing on those fronts, to be pushing for better provision, to be pushing for better legislation, for better understanding. And what we're doing today, we hope to be part of that, as creating a space for people to come together to talk about what is facing us in terms of the challenges and what we can do about it together. Mental health and LGBT plus liberation are key issues for UCU, and they are closely related to each other. And I think it's really worth reflecting on things such as a government survey a couple of years ago, which revealed a huge number of LGBT plus people had accessed or needed to access mental health services. And yet we've recently had a white paper where the effects of everything that's going on the LGBT plus community has effectively been erased. There's very little mention of the community in that paper. We're operating in a context of attacks on LGBT plus rights and an erasure of LGBT plus people. We are working in a situation where the government is not friendly, and we have an awful lot of work to do to press home the importance of liberation and freedom for everyone. And I think what we're doing today is a really important part of that. The speakers that we have with us today are incredible. I'm really excited to hear them speak. We have Steph Kiebel from Birmingham LGBT Plus Centre, who'll be talking about the survey that they conducted from there. Quinn Roche from the TUC on why LGBT plus mental health is a union issue, and Gus Cairns from AIDSmap, who will be talking about similarities and differences and what we can learn from the height of the HIV and AIDS epidemic with what's going on now at the moment. And I think this is going to be a really important conversation, and not the end of what we're doing, very much part of the beginning of what we're doing on these issues. And I think I don't really need to say much more than that. I am here as an ally. I am here to listen and to learn. And I'm so grateful to you for inviting me to be part of this and to have this opportunity to just really underline this is a union issue. It is of central importance to UCU, and we will do everything that we can to fight on this front and to support all of our members. So thank you very much, and I will hand back to you, Bea, as chair.
Thank you, Vicky. Thank you so much for your allyship and welcoming us to this meeting. So I will now introduce our first speaker, Quinn Roche. So Quinn is the TUC's LGBT plus and disability policy officer, working within their equality and strategy department. Quinn's pronouns are he, him, and he's previously worked for the Equality and Human Rights Commission and has been at the TUC since 2017. So over to you, Quinn.
And good afternoon. Thank you so much for inviting me here today to talk to you about this really important topic. I'm just going to try and share my screen and audio so I can take you through my presentation. But obviously, the technology has gotten away from me. So you can either see just my mouth or my full face. I'm not actually sure what's going on. Bear with me. I had to change my computer from earlier today because it just did not have the power. Seth, can you let me know if you can see my screen or what's going on? If you can hear me. Okay, well, I'm gonna work on the assumption that everyone can see my presentation, and I will take you through it. And I'll just be extra vocal to make sure that I'm covering all the parts in case you can't actually see what's happening. So what I'm going to talk to you today is about LGBT plus mental health and why it's a trade union movement, trade union issue. I'm going to explain what mental health is, what its relationship to the workplace is, what we know about LGBT issues, what research says. We're going to talk a bit about bogus employer-led programs and what we think needs to change in order to make sure we're doing right by all workers. So the first point is what is mental health? So the World Health Organization defines mental health as not just the absence of a mental disorder, but defines it as a state of well-being in which every individual realizes their own potential, that they can cope with the normal stresses of life, work productively and fruitfully, and are able to make contributions to their community. And what this is really saying is that we all have mental health, just like we have physical health. And sometimes we are well, and sometimes we are unwell. And it's really important to recognize that mental health is just as important as physical health. And can have a huge impact on our ability to kind of participate in work, education, and society. And it can vary enormously as we go through life and can be affected by a huge range of factors, and work is very much one of them. And then it's always helpful to kind of put a scale on what's happening. And so what we know is that 1 in 4 people will experience a mental health problem in any given year. And in England, 1 in 6 workers are affected by conditions like anxiety, depression, and stress. And as you'll hear later on, we know that LGBT workers and LGBT people have higher levels of mental ill health. And let's just talk a bit about language. So when we talk about mental health, we're talking about mental health problems, mental health illness, mental ill health, or mental distress. These are all kind of common terms that are used to refer to the full spectrum of kind of like conditions like depression, anxiety, psychosis, bipolar, and schizophrenia. But what is the relationship with the workplace? So if you can see my screen, and I hope that you can, what you see is a diagram that has thriving in work, struggling in work, and ill, possibly off work. And what it kind of looks to do is tell us about these 3 phases that we can all go through at different points in our lives. As our life fluctuates. So first of all, people can be in any of these things, but most people tend to be thriving in work. Sometimes people are struggling in work, and then because of certain conditions, people can become ill and possibly off of work. And people with poor mental health, and including common conditions like depression or anxiety, they can be in any of these boxes. It doesn't mean that they have to be ill or off of work. They can be anywhere. And an individual can have a serious mental health problem, but with the right support, be thriving in work. But poor mental health can lead to mental ill health, such as depression and anxiety. So right now you're probably thinking, I know a little bit about mental health, but what does this have to do with the workplace? Well, what unions think, what we think, is that workplaces should be places where everyone thrives, and employers try to actively eliminate the factors that cause people to struggle or become ill. And we believe being proactive can prevent workers from having poor mental health. And if we think about the social model of disability, what we're really saying is that workplaces should be fixed and adapted, not employees or workers. Workers should stay the same, but we should remove the barriers that are causing mental ill health. But what do we know about mental ill health and LGBT people and what's causing ill health? And what do we know about it before the pandemic? And what do we know about it now that the pandemic is active and on hopefully coming to a conclusion? So pre-pandemic, all evidence showed that members of the LGBT community were more likely to experience a range of mental health problems such as depression, suicidal thoughts, self-harm, alcohol and substance misuse, at a much higher level than people who aren't LGBT plus. And the higher levels of mental ill health among members of our community are driven by a range of factors, such as discrimination, isolation, and homophobia. And this is really what I want to talk to you a bit about. I want to talk to you about what is driving some of this ill health. And so we'll look at the statistics. So the TUC ran a survey in 2017, and what it found was that only 51% of LGBT people were out to everyone. And that reduced to 36% of young workers and young people, and was only 27% of bisexual people. And what we know is, not being able to be your full self, your authentic self at work causes mental ill health. But we also know that homophobia, biphobia, transphobia also cause mental ill health. And so what our survey found was that 39% of LGBT people have been harassed by a colleague. And what does that look like? Well, one person said they had a colleague who said all gay people should be put to death. And that's the kind of harassment we're talking about. The survey also found that 29% of LGBT people have been harassed or discriminated against by a manager. What does that look like? One person told us their manager made homophobic comments in front of him, knowing that he was gay. But let's keep going. The same survey found that 14% of LGBT workers have been harassed by a customer, client, or patient. And we have this very visceral comment here. We had a lesbian who had been hit, spat at, called a dyke. She called the police, and the company called her in for disciplinary action. So, even when LGBT people do complain, it often ends up back on them. So why is this an LGBT issue? So if I wasn't on this computer, I would have covered something slightly before this, which was the fact that our research also found that a higher proportion of trans colleagues had experienced harassment at work, and that has had a real impact on their mental health. So that led to the fact that 70% of trans people who responded said it had a negative impact on their mental health. And what we know is that looks like this. For example, one said that their boss was trying to withhold their sick pay after they'd had surgery. So these are serious things that we're looking at. But I will continue. So this is not the only thing that we as LGBT people need to be aware of. So we often talk about bullying and harassment, but what we tend not to talk about so much is sexual harassment, and that's a very specific form of harassment at work. So the TUC ran its own survey, the first of its kind, and we found that 7 out of 10 LGBT people had experienced sexual harassment at work. And we found that 1 in 8 women, LBT women, have been seriously sexually assaulted or raped. So that obviously has a massive impact on LGBT people's mental health. And that looks like this. Please forgive the pride is political, but that's, I first released this when we were doing that campaign. So we had one person said they were told they shouldn't be out if they didn't want to talk about their sex life. We had one person say that he had been seriously sexually assaulted and his manager thought it was funny and they made fun of him at work for weeks. And what we know is that 66% of people, LGBT people, do not report the harassment, the sexual harassment they have at work. And there's a very specific form of harassment LGBT people experience, which is that they don't report because they don't want to out themselves. And 25% who hadn't reported cited that as the reason. And finally, we have this last stat, which is that 1 in 6 LGBT people said their sexual harassment at work had a negative effect on their mental health. So we're seeing quite consistently that this is a real issue for LGBT people, and their treatment at work impacts on their mental health. And so what is happening now during the pandemic? What are we seeing during the pandemic? So before I even begin this, I want to point out that there isn't really a lot of data out there. There is no government data. None of the major government surveys actually ask about LGBT people and their experiences. So what we are relying on is what members tell us and what great LGBT plus organizations do, their own research. So Stonewall, the LGBT Foundation, Gallup, and a number of others. So without them, we wouldn't know. But it's also important to say that Sunday is the day the census closes. Please fill it in. Please, if you're LGBT plus, let them know. We need that data. It's so important to get that data. So what I want to say is that everyone has the right to have their health, safety, and well-being at work protected. But all too often, and throughout this pandemic, we haven't got that data, and the government have failed to find out what's happening to us. So members have been telling us that COVID has had a real impact on their mental health because of isolation. And we've also seen spikes in domestic abuse and spikes in neighbor abuse as a result. And this is really a lot of younger LGBT people are experiencing this because they have been forced to live back at home with family members who don't support them or their identities, and also their inability to get away from these individuals. So home has not been a safe space for a lot of people. And we've had that reported to us by Gallup, and we've also had the LGBT Foundation find some wonderful statistics. So the LGBT Foundation found that they ran a survey and 42% of respondents said they would like to access support for their mental health. 66% of BME LGBT people said that, and 48% of disabled LGBT people said that. So what we're seeing is intersectionality and the importance of unpicking that information. And we also had 60% of non-binary members and 57% of trans people. And 1 in 4 said they would like to get that support, and included things like a befriending service. But we also know that the LGBT respondents wanted it to be a specialist service. They wanted it to be provided by LGBT specialists. So what does the research say? So a few years ago, the government did an independent report called Thriving at Work. And it found more people are in work with a mental health condition than ever before, which is good. But actually it found that many were struggling emotionally, had gone off sick, and were less productive or leaving employment. And it found that 300,000 people with long-term mental health conditions left work every year. And to give you a context for what that means, that's around the population of Newcastle, or it's the population of Belfast. So that's big, very big. And their research found that 15% of people at work had symptoms of an existing mental health condition. And it did what this government is so good at doing. It put a number to it. And we found that the cost to employers was between 33 billion and 42 billion a year. The cost to the government was between 24 billion and 27 billion. And the cost to the economy as a whole was between 74 billion and 99 billion per year. And, you know, those are huge numbers. We know what they are because we've just seen what the COVID pandemic has cost us. Now, interestingly, what it found was 33 billion of that was from presenteeism. So people going into work when they shouldn't have been, and when they were just at work for and weren't productive at work. So that's a real issue. But it also found that the average return of £1 spent to address ill mental health at work saved £4.20. So, you know, what we know is that actually taking this seriously and looking to address it is a great, it is really important and great savings. Now, if you can see this slide, I'm going to apologize for Trump. I just put him on here because, you know, it's not a great slide that we're looking at, and I think he embodies that. But what we find at the TUC is that many organizations do not view mental health as a workplace issue, and do not view changing general workplace culture as a part of supporting mental health. So as a result, they try and change the worker, not the workplace. So employers, rather than trying to reduce stress, are introducing what they call stress management, which really has nothing to do with prevention. And being aware of these kinds of fake and ultimately unhelpful employer initiatives is really a big part of the battle of getting employers to address this properly. So we talk about employer-led programs, and we talk about them being bogus. And typically these programs have three parts. They talk about counseling aimed at helping employees cope and return to work. So it's around stress management, rather than dealing with the underlying causes of the stress. And they introduce initiatives like well-being. And often all these things are really not about changing workplace practice and prevention, but are laying the blame on the employee and saying that the issue is with them. And the biggest one of these is really resilience programs, which essentially say, we will teach you how to bounce back from the stresses that we put on you rather than address those stresses. And if you can't bounce back because your resilience gas tank isn't topped up, that's your problem. So we've got to be aware of these bogus employer-led programs and really have to address them. So the TEC, we've made recommendations on things we think employers should do. It's like address stigma, create a workplace well-being policy that really focuses on prevention, talk about putting in place reasonable adjustments for mental health issues, ensuring that any absence isn't related to disability isn't recorded in the same way. And we thought that this should be done in consultation with trade unions and staff who've had mental ill health, because they're the ones who can best advise us on what to get right. And that's a quick run through of my presentation. I'll probably save questions for the end and just really hope that everyone could hear me.
Thank you, Quinn. Yeah, we could hear you. Unfortunately, the slides were not coming up on the screen in the stream. So huge apologies to everyone watching that you couldn't see those. We'll see if we can do anything about circulating some of the statistics or information, perhaps.
Can I just say, they are beautiful slides. I worked hard on them. They are so lovely. We'll make sure you get them. I'm really sorry for that about that, but hopefully, my point was clear.
Yeah, thank you, Quinn.
Because I do that.
Yeah, I mean, there were lots of really, really important points you raised, and the one about resilience training really struck me, particularly as we've just had our wellbeing week at my institution, which I could not participate in at all because I was too busy. So yeah, anyway, thank you so much for that, and we will get the slides circulated to attendees so you can pick up on the richness of the kind of research and statistics there as well. So thank you so much, Quinn. So I'll now introduce our next speaker. Steph Kiebel is the director of Birmingham LGBT, a third sector organisation delivering services to LGBT+ communities in Birmingham and the wider West Midlands. So over to you, Steph.
Thanks, Bea. Hi. I'm going to try and share my screen. I'm aware that the last person, you couldn't see the slides, so I'll also try and describe some of the pictures where there are pictures and make sure they're circulated later. So I'm going to try now, fingers crossed.
Now I'm wondering if our tech support might be able to press another button or see anything that will add that. Here we go. Okay, we've got slides coming up now. That's great.
Okay, so I'm going to talk about the impact of COVID on the LGBT+ community and the research we did, what we found out and how we responded. Just to start off, a little picture of us. That's Birmingham LGBT Centre, opposite Radisson Blu, near New Street in the city centre. And we're a third sector organisation delivering a range of services to the LGBT plus community in Birmingham and the wider West Midlands. These include sexual health promotion, including clinics, specialist BME support, women's work, trans clinic, and a range of other initiatives, including services for people experiencing chemsex and a PrEP clinic. We offer an IDVA service, so independent domestic violence support services, counselling and wellbeing services for people experiencing mental ill health, support for people seeking asylum, youth work, older people services. We run a trans inclusion project, which includes counselling, youth work, wellbeing support events, so things like meditation, mindfulness, and also a strategic development officer who works with the health and social care sector and third sector, delivering policy support and free training. And we also have an arts and cultural events and activities, which includes Shout, Birmingham's Festival of Queer Culture. And the reason some people think it's a bit strange that we offer sort of arts events alongside sexual health and mental health services, the model we operate from looks at promoting well-being in LGBT plus people and communities. So it's about developing community resilience. So we're not just looking at addressing issues like poor mental health, poor sexual health. We're also looking at building resilience, and hence looking at things like arts as a sort of safe events, so that we can build spaces where people can access entertainment and be themselves, which aren't just around, although we're not denigrating, a bar scene which has traditionally been alcohol and substance driven, because those can be some of the detriments of poor mental health. So impact of COVID-19 research. So what we did, we were commissioned by Birmingham Public Health to develop a targeted health promotion campaign about safety messages during COVID-19 that targeted the LGBT plus communities. So we carried out 2 focus groups. One was LGB, one was trans and non-binary, and spoke in depth in those focus groups to 18 people in total. We carried out a survey and we had 158 respondents, and we commissioned a report based on the results. We also designed and disseminated campaign messages, but further to that, and I'll talk about it later on, we actually put some specific services in based on what we'd discovered. So what are the specific issues facing LGBT plus people during the pandemic? So we identified that the LGBT plus community faced a number of additional barriers during the pandemic. And these included LGBT, particularly older LGBT people, are more likely to be socially isolated and may not have contact and support. LGBT community groups, centres and bars, which are a lifeline for many LGBT plus people, are all currently closed. This was during lockdown. Some trans and they are again, some trans and non-binary people have had their appointments with gender identity clinics cancelled. LGBT people are more likely to have mental ill health, which is compounded by being in isolation with little social contact. So 1 in 4 LGBT people is experiencing or has experienced domestic violence. Many are now isolating with abusive partners or LGBT phobic family members, making it extremely difficult to access support in a safe environment. LGBT people who are not active family members are finding it difficult to access online or phone support in a private space. And we also found that LGBT people seeking asylum are isolated in shared accommodation and often experience digital poverty, so have limited access to mobile data and Wi-Fi connections, and finding it difficult to access online, social or any other form of support. So those were the sort of top line figures. So a little bit from the focus group. So what we found out, participants felt that their mental health had suffered and they were more isolated. They felt that The elements of their lives that relate to being LGBT plus are more difficult to access during the lockdown. Some expressed concerns about the future of gay bars and venues and pride festivals, which they felt were important to their identity. One participant mentioned they felt like they'd gone back into the closet during the lockdown, as they are isolated from family and friends and community and living with family who don't know they identify as non-binary or use the correct pronouns for them. Some trans and non-binary participants were uncomfortable with Zoom calls, as they felt having to look at themselves contributed to their gender dysphoria. Some trans participants were less comfortable with phone support, as they can be often misgendered on the phone. One trans masculine participant said they'd stopped binding during the pandemic, as they feared the binder could restrict breathing if they caught COVID, which would increase their sense of dysphoria. And most participants said they were drinking more. Some were taking more recreational drugs to cope with social isolation. So the survey we carried out found that the two main concerns people had were health worries, 69.62%, and isolation, 68.35%. Many people feeling isolated from their community, friends and family, and overall about 40% of the people we surveyed were living alone. The next two concerns were for their financial future, 44.30%, and relationships, 41.70%. A quarter of respondents felt they were unable to be their authentic selves or be out since lockdown. And a couple of quotes here that I pulled out. One described an overwhelming heteronormative environment, and somebody else said, I felt very alone and unable to be who I truly want to be. So just put a few stats in about employment. 70% of the people surveyed were employed by someone else, and 8% were self-employed. 4.5% were unemployed. 4.5% on long-term sick, 12% retired, and only 1% education. 46% of people said COVID had affected their employment. The ways included being furloughed, losing their job or business, increased workloads, particularly for NHS workers, adapting to working from home, and managing stress from employees. And put quote here, I've lost 3 jobs during this period. And another one, yes, 20% less wages, having to take mortgage holidays to ensure all bills are paid. So the impact on mental health, this came out very strongly. 70.55, so nearly 71% of respondents felt their mental health had been significantly affected by the pandemic. So in the last month, we asked people how had they felt in the last month over a series of questions. 63.36% had felt depressed, 77% had felt anxious, 64% had felt lonely, 13.74% had felt suicidal, and sadly we have lost a couple of members of our community locally to suicide, and 80% of people had worried about contracting or transmitting COVID-19 in the last month. I've put a couple of quotes in about what people said. So the first one, enforced loneliness for the common good is a new phenomenon, and this all reminds me of the early days of the HIV epidemic without the gay social cohesion. So drawing a parallel to the previous pandemic, but without that support and that community feeling that people felt at that time. My girlfriend has been struggling to access the gender identity clinic, and it's having a strong effect on her well-being. It's lonely, the support of the scene and social groups is missing. Some of the groups haven't transferred to the COVID world. I miss the community. I feel like I've gone back in time. And this one I found particularly difficult. Please find a way to reopen. I don't care if I have to wear a full hazardous material suit, as long as I can come in. Please, I'm at a dangerous low and others are too. Open the doors again. And that was one for us, for people who couldn't access the centre. So how we responded to what we found, and I'm still expecting a mental health pandemic coming out of this. So we started putting in things in place as soon as we got some of this research. So based on the research carried out, we designed a health promotion campaign, which is what we've been commissioned to do, developed around 3 main themes. So the first theme we identified was stay safe. So these were messages around COVID-19 transmission. The second theme we called take care of yourself, which were messages around physical health, because we found, and I didn't put those stats in, that lots of people were self-medicating to cope with poor mental health. And the third theme we called You Matter, which were messages around mental health. The design brief, we put out a brief and appointed a graphic designer, was to use the colours from the Lu Inclusive Rainbow flag, but not a flag, as this had become associated with the NHS during COVID. So I'm going to show you some of the images. So stay safe. We went for design as a bubble effect, which again has that idea of bubbles and COVID. So stay safe. If you develop any symptoms, get tested, stay at home and self-isolate for 10 days. Second one, take care of yourself. Stopping smoking reduces the risk of contracting respiratory infections. COVID-19 symptoms may be more severe if you smoke. And the third example, and there's eight different messages for each theme. And the third one was You Matter. We have not forgotten you. Isolation during COVID-19 can negatively impact mental health. We're still offering support services and counselling. We're here for you. So those were the 3 themes. The campaign's live. It goes out twice a week on our social media, Twitter, Facebook, Instagram. We've had quite a lot of interaction with it, particularly the You Matter. That's the one that gets the most shares, the most comments, etc. So a little bit about the support we offered and how we responded. So we managed to get some emergency COVID-19 comic relief funding based on some of what we'd found, which meant we were able to increase our counselling hours between August and January. So that was 6 months funding. And in that time, we were able to offer up to 16 free LGBT affirmative counselling sessions to members of the community. During this period, we delivered 306 counselling sessions to 40 different people. We currently have waiting lists for counselling. We have managed to extend that funding, so we can extend those hours for another year. But I'm sure if I doubled the amount of hours, we would still have people queuing up for therapeutic interventions. We set up a volunteer-led phone befriending and peer mentoring service. We already offered some peer mentoring, but we trained volunteers. We did 2 lots of training during lockdown so that people could offer some befriending support. So they could just ring somebody up for a chat who was also LGBT. They're not offering support or mental health support. If people need support, they would refer them into staff members for assessment and services. We also managed to get some support from Migrant Exchange, which is a grant to support people seeking asylum, which means we can provide food parcels, data packages, netbooks and dongles to enable people to access online support. So we've seen a 40% increase since the first beginning of lockdown in referrals to our wellbeing and counselling services. So we have 2 counsellors and then we have a range of wellbeing staff. And we talk about wellbeing as opposed to mental health because it feels a more positive approach. We currently have a waiting list for counselling as the counsellors are at capacity. We've seen a 25% increase in referrals to our IDVAS services since lockdown, so domestic violence advocacy. And up until the end of February, we had 82 new referrals. 20% of these were for forced marriage or honour-based violence, and 30% were high-risk cases. So like mainstream domestic abuse services, we've seen an increase during lockdown. It's also been more difficult for people to access support. We did open in September, but went back into lockdown in January due to the rate at which things were escalating. We're hoping to reopen next week. And, you know, most of our staff have had a first vaccine now. So we provided 42 hampers to people who were isolated at Christmas following a a fundraiser and 20 people attended a Christmas Day Zoom. We normally open on Christmas Day so that people don't have to be on their own. So sadly, we couldn't do that this year, but this was the alternative. So just a little bit about how people can help, because it was one of the things people asked in relation to LGBTQ communities and poor mental health. I've put a couple of suggestions in. So the first one was around, you can volunteer for local LGBT charities and groups to support community members. People could donate if they can afford to, either to local LGBT charities or food banks that are supporting people with food poverty through the pandemic. We can make referrals to the local food bank, and again, these have gone up during the pandemic. 3, stay connected, and I think this is the most important message. We know that talking to someone reduces a suicide attempt by 50%. We know that the community is feeling isolated from each other. So support your LGBTQ colleagues and friends, hold meetings, check in on people, just make sure they're okay. Talk about LGBTQ stuff so people feel a sense of identity. Put on events. They don't have to be, it could just be a social event where people get together after work on Zoom and have a cup of coffee. I know it's not the same as meeting in real time, but those things can be really important to people. And the fourth one I've put is take care of yourselves and be gentle with yourselves. We're all living through a really difficult and unprecedented times. So ease up a bit and just be kind to each other and to ourselves. And that's sort of it from me. I'm going to stop the share. Hopefully that all worked.
Yeah, that's worked. Thank you, Steph. Thank you for your presentation and for kind of all of the work that you're doing. So we will have some questions at the end. So we're going to go to our last speaker now. So Gus Cairns, 64, was diagnosed with HIV on the 25th of September 1985. So he has spent more than half his life living with the virus. An LGBT community activist before HIV, he joined Gay Switchboard in 1979 at the age of 23, and also worked on the National AIDS Helpline in the late 80s. His interest in international treatment and activism in HIV prevention led him to become a community chair of the PROUD study, which in 2015 demonstrated the efficacy of PrEP. So I've slightly shortened your intro there, Gus. I hope that's okay. And over to you for your talk.
That's okay. My pronouns don't seem to be up there. I'm he and him. So yes, I'm glad I did set out a fairly long introduction, because I don't have to talk so much about my personal story through HIV and LGBT activism. I've been asked to really talk about the sort of parallels and differences between HIV and COVID. And when I first thought about this, and I was thinking about this from the beginning of the sort of COVID epidemic onwards, I was thinking, well, the differences are more striking. But I think in terms of the way that it's affected people's mental health, there are similarities. I think one of the most interesting things when something like this turns up is that people go initially into stages of disbelief, denial and loss. And certainly I was talking to a Polish doctor the other day who said we couldn't believe that it was going to be as bad as it was, talking about the COVID epidemic. And certainly I remember that happening very much with HIV in the early days. And denial and a sense of loss are common to both of these. The previous presentation, a lot of the service users talked a lot about missing socializing with the people they know. And I'm sort of living in a sizable house with a reasonably well-off partner with a nice garden, and I'm, as probably as well looked after as it's possible to be during lockdown. And I've been going crazy. If I was a young LGBT person who is mainly, whose social life is mainly conducted in the on the gay scene, I'd be going bonkers, I think. That's not a technical term. So I took an interest in mental health through my own experiences of depression and anxiety, but also because that's what I found I was good at working with. When I started working in Gay Switchboard, it was soon an education into the terrific isolation of people out there. You have to remember this was 1979, and the gay scene was very different to what it is now. Yes, male-male sex had been decriminalised 10 years earlier, but the age of consent for men was still 21. There was active criminalisation of gay men still, and victimisation by the police. You could be done for looking the wrong way at a policeman through the soliciting law. You could be entrapped by a so-called pretty policeman for having sex in the public area. And the gay scene, even in London, was extremely small. Most people were not out at that point. And even in London, until Heaven nightclub opened in 1980, the gay scene was very small and concentrated in a few pubs in North London. And then it started to blossom in 1980, and one of the most powerful things about the recent It's a Sin series has been to reflect not the awful events of the HIV era, but the contrast with the very short-lived period of the blossoming of a gay community beforehand, and how HIV seemed to come along and almost exact, not just in the views of the outside world, but also inside people's heads, with a punishment for that. I think the difference between HIV and COVID is that although there has been a lot of finger pointing and blame within COVID, certainly there has been finger pointing and blame at people who have been going out and not being good and sticking at home. And I see people, I get very impatient with people being blamed for, socializing, not wearing masks, things like that. A lot of the time, these are not people who belong to a libertarian fringe. They are just people who are trying to meet each other. And I think that that needs to be understood. But I think the difference between HIV and AIDS are probably more striking. Firstly, COVID is fast, extraordinarily fast. The epidemic changes all the time. We couldn't believe how quickly it happened. HIV was slow, meaning that there was time to deny it, but there was also time to form a community in response to it. And although I am British and I have noted that there was the beginning of a politicized and very supportive LGBT community before HIV came along. It's been interesting to see, to compare that with other countries where that didn't happen so much. An interesting example is France, where there wasn't really much of a politicized or social gay scene until HIV came along. And it was in response to that that it more or less formed. I don't know if any of you have seen the remarkable film 120 Beats a Minute, which is based on the experience of ACT UP Paris and the formation and activities of the French HIV activist movement. But that shows that. So HIV had a positive effect, which was that it compelled the formation, as I think Quinn remarked, of a community in defense against this terrible disease. And I think COVID has tested the solidarity of that community, because it is a community that was based on our queer families. our families that we that we got together with, often in response to trying to find something better than the non-supportive families we might have at home. My family were very supportive, but at the same time, if you grow up an LGBT kid, you do sometimes feel like the apple that falls far from the tree. And I remember this sense of like seeking my tribe when I came up to London, and COVID has really tested that. I don't need to say what Steph has talked about so eloquently in terms of the price of isolation and of not always having the opportunities to interact with the people who support us. I think one of the differences with HIV is that it is an STD, which COVID isn't, and that hooks into a whole different level of shame and the different kind of distress about the body. And that had very specific and very difficult to overcome effects, I think. Russell T. Davies got a character in It's a Sin to talk about how HIV seemed not just exquisitely targeted at despised minorities, and of course it wasn't just gay men at all, it was also injecting drug users, migrants, people like that, but at behaviours those minorities themselves had internalized stigma about anal sex. And I think one of the misfortunes about that is that we initially developed safer sex and condom use as a way of looking after ourselves and each other. But unfortunately, it got hooked into that shame and became something that became a definition of whether you were a good gay man or not, as to whether you used condoms. And that later on, I think, meant that when new answers to HIV, such as PrEP and such as the fact that if you take HIV treatment, it means you're not infectious, encountered some resistance from the community because I think the stigma hooked into a sense that we mustn't ask for too much. We mustn't, it's dangerous somehow to let go of safer sex because that might damn us in the eyes of the larger community, and we mustn't ask for these biomedical things that protect us instead. And I do wonder if some of that is behind sort of anti-vaccination feelings with COVID as well. I've been asked specifically as to whether mental health is a meaningless concept unless it's situated in the ordinary lives of people. And I agree totally with that. I much prefer the term, by the way, well-being, because that suggests a positive thing to aim for. Mental health is a bit of a euphemism because we're really talking about mental distress a lot of the time. And I'm a holistic psychotherapist by training. And I think that what we talk about in terms of mental distress, or what you might call a lack of well-being, spans the whole spectrum from conditions that are quite clearly have a big organic component in cause, if not treatment, to things that are quite clearly socio-economic in cause, and where the solution is much more to do with putting somebody in a more fortunate phase of life rather than sort of giving them treatment. But I think it's wrong to oppose a medical model of mental ill health in all situations, because sometimes, of course, psychopharmacology can be a lifesaver. You're talking to someone, someone here is talking to you who at different phases of his life has twice taken antidepressants, for instance. The first time was during the period of enormous transition when I actually came back to life, almost literally, from having AIDS, had to go back into employment. And at the same time, probably 2 months after that, my father died, luckily just after I had recovered my health. And that was a terrific period of stress and transition, and I needed something at that time. The second time I took antidepressants, they weren't the answer I was looking for. It was in the aftermath of a breakup. I didn't need it. I needed to talk to somebody. So I think in terms of the question that's been asked about what can be done to help improve LGBT mental health, I think it is very difficult at the moment because there aren't enough services around, like the splendid one that that Steph runs. I have worked for a few of these in the past. I used to work for PACE, the much missed LGBT mental health charity in North London. I have worked for Pink Therapy before now, but there aren't enough specialist services. And certainly with COVID, a lot of the way that people are going to have to find the mental health support is through the mainstream health service, not just through GPs in some cases, but it's also worth remembering that a lot of things like the sexual health clinics offer much more specialized services than they used to, because there's much more awareness of things like chemsex and substance addiction and stuff like that amongst the LGBT community. I also think there's going to be a challenge about renormalization. It's often difficult to come back to Civvy Street after a period of wartime, and certainly the 4 people I know who committed suicide during the HIV years were all in recovering their health at the time. So I think some of this is the legacy of trauma. As for what works, I'm a great believer that whatever works for you, and that may be anything from gardening and music and art to much more sort of formal answers like talking therapy and support groups and things like that. I've found resources in everything. And I think as COVID ends, I hope we will, if we are feeling isolated from our queer families, feel able to rejoin them. I certainly miss some of the interactions I've had with mine. I think I'm going to end it there and hand over to chairs again for questions. Thank you very much. It's been a privilege to talk to you.
Thank you so much, Gus, for sharing your experience and kind of personal experience and professional experience. That was really enlightening and really important. So thank you so much. So I think we have some pre-submitted questions that are going to come up on the screen. I will read them out and then we will ask our panel to answer them. So if I could get the first pre-submitted question up on the screen, that would be helpful. Okay, so the first question, what support is available for LGBT plus people struggling with their mental health? So would any of the panelists like to answer that? Okay, great. First I've got Steph. Yep.
Unmuting myself, it's a new technology. There's a range of support options for people. In some areas there will be specialist, culturally competent support, so LGBT affirmative counselling and psychotherapy. We run specialist counselling. Gus mentioned Pink Therapy. They will have a list of LGBT affirmative private therapists in different areas, because some people will be paying for talking therapies as they fear some sort of prejudiced reaction from the mainstream. There are also mainstream services available, whether that's services like Mind or Relay to Respect to Charities, or whether that's statutory mental health services, and that would be a GP referral. All services should work with people in an affirmative way, and they should be working with LGBT people in a positive way. So I think it's important that if people don't get the right response, they know how to challenge that. What's really important is that whatever support they access, it's affirmative. So people have probably seen that the government still hasn't outlawed conversion therapy, and we have real and legitimate concerns about this because people are still maybe via religion or cultural organisations being offered this, and we know it causes a lot of damage. Gus made the point about sexual health providers. The NHS locally offer LGBTQ affirmative counselling as well as part of the sexual health services. But also I think let's look holistically at well-being. It's not just about looking at when people get into crisis. What we know promotes well-being is being with other people. The we in well-being, there's a we in well-being, there's a big I in isolation. So I think it's really important that people are able to connect to friends and family and also their community. For many people, family is family of choice. So even though it's more difficult in these times, I do think it's really important that we all do everything we can to keep our communities connected and together, even if there isn't a real space we can visit. We've put on lots of, we had to adapt our services quite dramatically, so we've been putting on things like quizzes and coffee evenings. We set up a men's forum, we've set up a women's forum where people just meet once every couple of weeks and have a coffee and have a chat. And we weren't running those sorts of services before. They tended to be run by peer support groups that we gave free meeting space to. So I think it's the main message is just keep talking to people, just keep connected, and keep remembering. At the moment, we've talked a lot about It's a Sin. It's really galvanised the community here. We've got a massive fundraiser going on for a memorial for people who were lost in the 90s. So remembering how we came together, we're not in physical space now, but we can still stay together and we can still stay connected, because the LGBT community, for all its diversity, is a really strong one. And I think that's a really important message to get out there. So I think I've sort of started with mainstream services and ended with peer support, but I think all of those things are important.
Thank you, Steph. Would Gus or Quinn like to come in and add anything at this point?
No, really. I mean, I'm glad I sort of finished my talk the way I did, because it sort of seemed to lead on to this naturally. I'll talk about my own particular kind of queer family that I miss is my choir, because music has always been very important to me. I belong to the 4th choir, which is an LGBT choir. Can't wait to meet up with them again, but we've been doing our online rehearsals. So I think the enjoyable exercise of a skill with other people is also a fantastically good thing for mental health, not just sort of like social stuff, but actually doing stuff together, especially if you can do it online. That's all I'm going to say now.
Thank you, Gus. Quinn?
And I'll just tag on. I think what Steph said is exactly right. Going from the kind of professional to the more ensuring you reach out and stay in touch with your community. And of course, unions do that. You know, we're doing that right now. And so I would always recommend that you could stay in touch and access the services and networks that your union provide. But also, you know, if you're in a local area and you don't know where they are, you can always, you know, you can Google them. So find your local services, find your community. We're here, we haven't gone away, and, you know, we'd love to engage with you, basically.
Thank you. And yeah, of course, many branches have equality officers and LGBT officers. So if you're struggling, get in touch with your local branch and they can help signpost you, I'm sure. Great. So do we have another pre-submitted question that you could put up on screen, please? Okay, so this is slightly different but connected. So what advice would you give to LGBT+ people in rural areas? Would anyone be able to offer any advice or suggestions there?
I did say I'd take this one earlier. I was just waiting to see if anybody else wanted to go, because I don't want it to end up being the Steph show. But I think one of the things that's really important, again, is to just make sure if there are any online groups where you can stay connected. One of the things, there are lots of, I talked quite a lot about people who couldn't use digital technology. Actually, what I didn't say is for some people, it's made services much more accessible. So when we did the audience feedback survey from Shout, which is our queer arts festival, there were lots of people saying they found these events much more accessible because they could watch them online rather than turning up in real time. So if you're all really isolated, we have things like Skype, we have Zoom, we have ways of people being able to connect. Again, there may not be specialist services, but it's worth checking Pink Therapy. It's also worth checking the Lgbt Consortium's website. They're a national infrastructure body, and they will will have a list of member organisations, but also groups, because quite often there will be something in rural areas. It might be a, you know, chat now on Zoom, but there will be something available. And also people can connect to larger groups or organisations. One of the things we found about Zoom, as I said, we open every year at Christmas. On Christmas Day, we normally have a party, M&S buffet, you know, we do it properly. But this year we weren't able to do that. We provided hampers, but what we could do is advertise that Christmas Day social nationally, because anybody could have access via Zoom. So there are some ways where digital technology makes the world a lot smaller. So some of those challenges of rural isolation can be overcome through using some of the technology we've got. Obviously, if somebody's really, really poorly, we would always encourage them to go to their GP. And we'd also do things like give out the Samaritan's number, who are on the end of the phone 24/7. There's a switchboard still available. I'm not sure their times, but London switchboard, for example, that people could ring. So there are still places where people can access support. It might be more difficult to find an LGBT organisation that offers specialist counselling, for example, but there won't be nothing. Hope that covers it.
Thank you so much, Steph. That was really comprehensive. And I think you're right, that the pandemic has obviously caused there's lots of difficulties and is horrific traumatic experience. There are ways that it's brought us together, for example, online, and you know, being able to have events like this is really important and helpful, I think. So do I have another pre-submitted question, or did anyone have anything to add before I move on? Sorry. Okay, next question, please. So how can we support people who are providing voluntary support to other LGBT plus people? Do any of our panelists have anything they can add on, I guess, peer support, isn't it? People giving peer support. Oh, Gus, I think you're muted.
Myself.
There we go.
And I should learn to wave. I suppose that's how I started. Having left university and only recently sort of come out during that time, basically, Gay Switchboard was a peer volunteering position. I regarded it as my proper job at that time. I was doing a slacker job, being a bus conductor, because I wanted to do something for the community. In terms of how we can support people who are providing voluntary support, sometimes that was tough, and it became tougher as HIV came along, and certainly as when I was on the National AIDS Helpline. And I think there's no real answer other than to provide supervision to people who may be working extraordinarily hard to support people in the most difficult possible circumstances. I have been too busy to belong to my local COVID support group in anything more other than taking an interest. This is not an LGBT specific group. This is like the local South Brent support group. But they have been coming across some of the most, terrible cases. People, in instances of modern slavery, for instance, where people have been sort of isolated within their houses as servants and things like that. And I think the solidarity of the people and also the skilling up of the people in that service has been quite remarkable. And I would put an emphasis on skilling up. It's not just about give. Volunteering is also about getting something. And what you get is that you get skills. And what you need is a structure that enables you to develop those skills in a really good sort of way, no matter what kind of organization it is. And so the best thing you can do to support people who are volunteering is to treat them as if they're not volunteers, but instead people who are engaged in educating themselves in order to support other people. I think that's the way I'd put it.
Thank you, Gus. That was really helpful. Does Quinn or Steph have anything to add there? Steph, go ahead.
Just unmuting. Yes, I just wanted to say that I think it's really important that people volunteer, and some people will be providing voluntary support within the community just as peer support. One of the things I think that's quite important if we want to support people who are supporting other people is to support them to know their limits and their boundaries. So sometimes people really want to help, but they might not be the best person to do that. They might not be appropriately qualified to. And actually, if people keep trying to help when they're not able to, you can get really burnt out and it can be really stressful and difficult. So I think it's about supporting them to recognise what they can and can't do. I think that's really important. And if it's something where somebody is really out their depth, so if somebody's supporting somebody who's feeling suicidal, that person really needs to be talking to somebody who knows how to support them with that. The fact they've had a conversation with somebody who's supporting them voluntary is great, and you can say to them, it's really glad that they've done that. Make sure you give them Samaritan's number, encourage them to talk to their GP, because I think sometimes people really want to help but can end up getting really out of their depth, and that's why if they're volunteering via an organisation, they'll be trained, they'll develop skills, they'll give back to the organisation, but we have a volunteer coordinator, for example, they'd get debriefing, they get support, they get training. We also don't use volunteers to do what paid staff should do, so we have volunteers in supporting roles. We don't have volunteers running services, and I know that's a model some organisations use. We don't, so that they're there to support paid staff. So we don't think that they should be working with people with significant mental health issues, because we have people who are paid and qualified to do that. So I think it's around getting them to recognise their boundaries. We do have volunteers doing befriending calls, for example, because people want to do that. They want to stay connected, and that's something that we run as a volunteer service. So I think it is about supporting people to get proper support for themselves, recognise their boundaries, recognise their limits. Don't give your personal phone number out to somebody who's then going to ring you at 3 o'clock on a Saturday morning when you could be doing all sorts of things. I'll leave it at that.
Thank you, Steph. And Quinn, would you like to add?
At 3 o'clock in the morning, I'm sleeping. That's where I am. I'm definitely sleeping. I think, Steph, what you're saying makes complete sense to me. And I think, when we're talking about this, it's about knowing your boundaries and encouraging people to seek support from other places. And I just wanted to remind everyone who's watching that a lot of employers offer an employee assistance program that's free of charge that their members can access. So, if that person has reached their limit, they can politely but firmly direct the person they're helping to access that service as well. And I just wanted to kind of remind people that exists.
That's a really useful reminder. Thank you, Quinn. So I just want to let people know that we will have time to take a couple of questions from the audience. So if you want to write into the comments box, I'll try and pick a question or two out from there and pose it to our panel. So I'll give you a couple of moments to do that. Now, I think we've got another pre-submitted question before we take any questions from everyone watching along. So could we have the question put up, please? If we have another one, do we have another pre-submitted question? I'll just give it a moment. So if anyone, no, we don't. So if anyone has a question that they'd like to put in the comments that I can pick up, that would be really great. I'm just going to, while people are thinking and posing their questions, just highlight a couple of the suggestions that people have put in the chat that are really helpful. So Maya has said that Rainbow Pooch Pride offers some ACE support, and they have the next 2 Sundays are going to be around mindfulness. So that looks like an organisation that we could be Googling. It's got pooches and pride, so count me in. Sounds good. And I will also apologise if anyone's heard any strange snoring in the background while I've been talking, because my dog has joined me. Speaking of pooches, she likes to interrupt all my Zooms. And yeah, I can see that people have made comments about, you know, resilience training being kind of challenged and resisted as a kind of the main model of education providers, kind of dealing with mental distress. It's to put kind of it onto individuals. So I can't see if there have been any more. I can't see any questions that have come into the comments to me yet. I can see that our signers are just going to switch over again as well. So while that's happening, there we go. Perhaps it would be okay for me to ask a question. Oh, okay, we've got one in the chat now. Hang on, I'll read it out. So, does anyone feel there is any hope with the current Tory government that we will move forward with these LGBT plus issues, or are we swimming upstream? Big question. Does anyone on the panel feel they can tackle that one? Steph, thank you for wading in. Go ahead.
Happy to have a go. What I would say is, yeah, it's a very interesting question. It is the current Conservative government who actually proposed a lot of the changes. So certainly Theresa May, I know this was prior to Boris, but Theresa May proposed the Gender Recognition Act consultation. We won't talk about the response just yet. And certainly a ban on conversion therapy, which still hasn't happened. I think some of the recent concerns, and it's certainly one I feel, is around the new lead for Women and Equalities, Liz Truss. There seems to have been a real shift since she came into that position. Prior to that, it felt like there was a lot more engagement. There were LGBT advisors at Government Equality Office. We got a lot of intel as the National LGBT Strategic Partnership. They were setting up the the LGBT what they called the network that Free People have just resigned from, and there was an action plan, there was funding, there had been funding made available for homophobic, biphobic and transphobic bullying in schools, and this feels to be changing. And one of my concerns isn't just around LGBT issues. I think the general equalities agenda is actually at risk at the moment. The minister has recently talked about the Equality Act and looking at moving away from that. We've moved out of Europe and there might be an individual Bill of Rights, which again is a concern, and without wanting
issue.
Workers' rights as well. So I do have some real concerns. However, there are still lots of people campaigning and lobbying. What I would say is whenever a consultation comes out, make sure you fill it in and you get it round to as many people as possible. The bathroom bill, our trans worker recently did a response to that. That wasn't sent to us from Government Equality Office. So it seems to be that, you know, things aren't being circulated as much as they were, but we need to remain united in solidarity with our LGBTQ communities, and we need to respond to as many consultations as possible. We have a voice. They are going to want to vote for them in a few years' time, and let's be honest, on the back of the pandemic, they're going to have to work quite hard for those votes. So I think it's really important, and again, to lobby your MPs over these issues. Conversion therapy is on the agenda at the moment, and it needs to be banned. I do think that the Prime Minister is probably more liberal around some of these issues, so I think there is potential, but I don't know where we're going. What I do know is it feels like we could be moving backwards in terms of some of our human rights unless we keep this on the agenda at the moment. That's my feeling.
Thank you, Steph. Quinn, are you indicating? Yeah, come in and answer the question, Quinn.
Sorry, it's everything is reversed, so I rose the hand you couldn't see. I think that's a really good question, and there's a lot to it. I think we need to remember that it was the Tory government of years who introduced the Red Tape Challenge, which was looking at removing the Equality Act. So I think we have to, as a union movement, be really careful and strategic about what we do and how we try and ensure we get the change we need for LGBT plus people and for actually all people. So I personally am really concerned and don't want to give this government any excuse to open the Equality Act, because I believe if they open it, they're going to tear it up or reduce our rights. So I just think we need to be really careful and really strategic with what we do and how we do it. And also not to forget that we know this government are trying to use LGBT plus issues as a divide and conquer tool. We know they want to start a culture war and to keep the left divided so that the right can continue to be in power. So we mustn't let them do that. We mustn't let them make trans a divisive issue. We must stay united and continue to, as Steph said, respond to all consultations, take every opportunity to tell them what we think, but do it strategically and not let them divide us and try and conquer us.
Thank you, Quinn. I'd just like to give Gus an opportunity if he'd like to add anything on that question.
Yes, I mean, the law is a force for good, but as well as being something that can sometimes be difficult. Interesting trade union issue announced yesterday, a great victory, the Uber situation, which shows that, you know, a group of people can get together and still campaign for legal recognition of their rights. I think a lot of the work I do is very international, and I've seen legal victories in the most unimaginable situations, such as the victory of the Treatment Action Campaign in South Africa, which actually sued its own government in order to get HIV treatment to the majority black population of that country, which was an extraordinary achievement, one that 2 years previously politicians were predicting would never happen. I think you also have to hook into sort of underlying and critique the underlying kind of philosophy. I'm really interested in the critique that's been coming through about resilience training, because that's always sort of annoyed me as well, because it hooks into what I call, and this is very unfair, but I've called Oprah Winfrey liberalism. And I'm afraid I've picked her because she's sort of a bit of an exemplar of the, you too can dream this, you know, you can achieve your dream. It's a neoliberal tale. And that needs to be sort of critiqued sometimes, because sometimes the structural things that stop us achieving are stronger than any kind of individual personal qualities we may have that get beyond that. And so both need to be addressed at the same time. So I think sometimes it's about the law, and sometimes it's about critiquing the assumptions that underlie a particular attitude to rights, which can rebound to the detriment of other people seeking similar rights. And I think we've seen that in the whole debate around trans issues.
Thank you, Gus. And thank you for linking the question around LGBT rights to the wider kind of trade union movement and international struggles. I think it's really important and useful that we think about all of our struggles as connected, and international solidarity and solidarity across sectors of work. I think that's really, really great note to wrap up the session on. So thank you so much to Gus, Quinn and Steph for speaking to us today, giving up their time of their really useful and interesting and important presentations. Pardon me while I just nudge my dog, who has just started snoring. Thank you so much to everyone behind the scenes at UCU who made this event happen. And thank you to everyone that's watching along on Facebook and YouTube and the live stream. So I hope you'll have a nice evening. Stay safe, take care, and yeah, thank you for watching.
Thank you.
Thanks very much and goodbye.
Bye, folks.
Bye, thank you. And I should also thank Vicky before we go off the live stream. So thank you so much, Vicky, for opening the meeting.